Cancer survivor is defined by the National Coalition for Cancer Survivorship as anyone with a history of cancer from the time of diagnosis and for the remainder of life, whether that is days or decades.
Every day, just to survive this place, I'll probably follow the same steps to survive outside. Number one is smile, even if you're not in a good mood. Number two is breathe. Breathe like you actually want to live and not just like passively, like it's a passive function of your diaphragm, just like an involuntary action. And three, baby steps to everything. If it's just like, you can only take one mouthful of food, take the one mouthful, stop.
I lost all my hair, and it was devastating. And then I said, you know what? People are shaving their hair and they're not even sick, so what am I crying for? So I just got it together, you know. I said, well, you know, God, I could be dead. So what am I crying for? I gotta be thankful.
Be positive. Positive. Best thing to do. You can't sit around and be negative. You can't feel bad for yourself.
I realize what's important in life now. You know, I have a whole new perspective of life. This is I consider this to be my second life. This is my second life. I'm starting over again, brand new.
This part of the DVD presents nutritional guidelines for patients undergoing cancer therapy. We'll describe some of the most common nutritional problems associated with cancer and cancer treatment, and give you some tips to help you minimize them. Cancer itself and the various treatments make big demands on your body. Eating healthy is especially important at this time. You need to supply your body with enough fuel so it can repair and heal. Food is fuel for the fight against cancer.
So we have a lot of control over food, and what folks don't appreciate is that foods are drugs. They're not regulated by the FDA, but our body sees them as drugs. They tend to be very subtle in their action, but our body is designed to respond to the stimulus of certain foods. And when we have those foods flowing through our body as we're recovering from chemotherapy, it'll turn on the machinery to hasten our recovery.
Eating the same types and the same amounts of foods you enjoyed before your diagnosis of cancer may change or become difficult. Eating less is the usual response, but eating more is not uncommon either. Side effects of cancer therapy may affect your eating habits. Some foods may taste less appealing to you and cause you to eat less of them. Dietary problems you had before your diagnosis may be aggravated by cancer and its treatment. For example, if you were sensitive or intolerant to certain foods before your cancer diagnosis, you may become more sensitive to them during treatment.
Each person's experience with food and nutrition during a cancer treatment will be different based on the type of cancer that they have, the stage that they're at, the types of treatments that they're getting, and the medications that they're getting. And so it's a combination of all of the above.
At first, coping with changes in your eating habits may seem overwhelming. You may feel anxious about eating enough of certain foods, or you may become afraid of eating what you think are wrong foods, and then eat very little at all. These are all normal reactions.
I did not want to eat. First of all, food also smelled bad. So even before you got it in your mouth, you know, there were smells that were clearly not normal, and certainly not what I was used to, and they weren't inviting. So there were, you know, that's step one. And then step two, getting past that, is how is this food going to taste and what do I need to do to really get it in my body to optimize my body's opportunity and chance to make the most of the therapy.
In the next segment, we'll discuss how cancer treatments can affect eating habits and give you guidelines how to cope with changes in how you feel and how you eat and drink. There are several reasons why cancer treatments affect the ability to eat and digest foods.
I think there are many reasons why patients undergoing cancer treatment may have nutritional issues. Sometimes the cancer itself may be the cause. For example, if someone has swallowing difficulties or tumors that may cause diarrhea, nausea, vomiting, mechanical obstruction, these are all reasons why the patient might have difficulty with eating.
Actually, with the chemotherapy, there's a tendency to get mouth sores, which I started to get. But they give you two different mouthwashes, and they're not terrible. And I put something additional on the actual area where it's more sensitive.
Our enjoyment of food, the sense of taste, our sense of smell, all are affected by chemotherapy. So very often, people who are undergoing cancer treatment don't have much of an appetite, sense of taste has changed, food doesn't taste right.
I had the most difficulties as a cancer patient with the taste changes that happened with the chemotherapy. And in addition to that, the fatigue that happens with chemotherapy.
But all kinds of odors, not only just food, but I was very sensitive to things. There was a hand soap that I won't mention the name. We don't want to get them in trouble. But there was a hand soap I had used for years. And all of a sudden, the smell of it made me nauseous.
Another aspect of cancer disease and cancer therapy that truly impacts nutrition intake for patients is pain. And when a person is in pain, that often overrides all the best intentions of what a person knows they should eat, wants to try to eat, and yet just can't break through that pain in order to do it.
Malnutrition and weight loss are real problems for many patients with different kinds of cancer. But weight gain is actually more common and more serious of a problem.
A lot of folks think their recovery from chemotherapy or any cancer therapy is dependent on what they eat, and they're absolutely right. But they often forget that it's also dependent on how they exercise. You know, folks put on a lot of weight after they get chemotherapy because often they're getting steroids. Steroids will force you to eat more because they generate more appetite, but they're also important in that they waste away your muscles. So if you don't have the muscles, you're not burning the calories, so you start to put weight on.
To obtain the nutrients and other substances needed to help in your recovery, vary the foods you eat. Foods contain combinations of nutrients and other healthful substances. No single food can supply all of the nutrients in the amounts you need.
The food pyramid gives you guidelines in that there are 5 major food groups. You have your grain group, your fruit group, your vegetable group, your milk, and your protein, meat, fish, and chicken group. And the food pyramid gives you guidelines as to how many servings you should have a day from each of these groups.
If you follow the pyramid, you'll eat more fruits, veggies, whole grains, beans, and less meat, fats, sugar, and salt.
The food pyramid provides healthy people with guidelines for food to eat that really will help them optimize health and nutrition. The food pyramid may not be what you need to follow during cancer therapy itself, simply because at that point you may have such taste aberrations, taste sensations, that even something as common as fruit, which is important for healthy people to prevent cancer, may be something that your body just either can't tolerate the taste of, or if you're getting radiation to the abdominal area, you may actually have difficulty digesting.
Some cancer patients may have trouble consuming enough of a wide variety of foods to satisfy nutritional needs. Many liquid meal replacement beverages can also help satisfy protein requirements during cancer treatments, but they should not be consumed in excess.
Sometimes it's difficult to chew and swallow, and it's painful, so we encourage things like oral supplements.
Following the food pyramid can present challenges for cancer patients undergoing a variety of treatments. There are several kinds of major treatments for cancer. These are surgery, radiation, chemotherapy, and biological therapy, which is largely immunotherapy. Each may present issues and the need to modify food choices and eating habits. Side effects are another concern that we'll explore and give you nutritional tips. Surgery is often the preferred initial treatment for tumors that have not spread, and it can cause temporary or permanent challenges.
Well, in terms of cancer treatment, each of the treatments has important nutritional effects. In general, we have surgery, chemotherapy, radiation, and immunotherapy. The effects of surgery are based upon what is done, what is removed. If it's involved with the head and neck, it's harder to chew or swallow.
Very often, people who are undergoing treatment like this find that they're not able to eat 3 large normal meals a day as they did previously. And so we often recommend what we often not recommend in other circumstances, and that is grazing. What we mean by that is smaller, much more frequent meals, able to take in adequate nutrition, same exact caloric needs are met.
Radiation treatments can lead to nutritional problems, just as surgery can.
Radiation has its own set of side effects that patients have to deal with, again depending on the area that has been radiated. Very often, if it involves the upper digestive system, patients can have nausea and vomiting associated with that, just as they do with chemotherapy. Sometimes patients who've had an area of their throat or mouth radiated can notice a very sore throat. There can be difficulty swallowing. There can also be a dry mouth with inadequate amount of saliva, which presents its own set of problems in being able to eat and swallow properly. There are various measures that can be taken. Sometimes we even halt the radiation for a period of time to allow the area to recover. There are medications that can be given. There's artificial saliva even that can be used to help lubricate the mouth. Many of these are useful. Sometimes only tincture of thyme is useful in helping patients, and that is knowing that this will recover in a period of time once the treatment finishes.
Chemotherapy, unlike surgery or radiation, is systemic and can affect the entire body rather than just part of it.
Chemotherapy also causes a number of immediate effects. It often causes some difficulty with nausea, vomiting, pain in the mouth, dryness, and so forth. It has, and of course, it'll cause severe nausea and diarrhea, and these can have profound effects in a previously healthy individual.
Hormone therapy is most commonly used to treat cancers of the breast, prostate, ovary, and endometrium.
Hormones can also be associated with changes in appetite, changes in taste. Depending on which hormone is used, some patients may notice the same effects as they do with other steroid medications. That is, a dramatic increase in appetite.
The hormone therapy that men go on, which lowers your testosterone dramatically, can give you hot flashes, but can make you gain weight, especially around the midsection. I have men that are doing 50 to 100 sit-ups a day, and they're not able to take this off.
According to cancer treatment experts, that is why exercise is so important to build muscle and bone mass rather than excess fat. So far, we've described several different challenges you may face depending on the type of cancer treatment you're getting. Now let's talk about some of the specific issues you might be having with food and eating problems. We'll provide some suggestions. These suggestions are not meant to replace talking to your doctor. Be sure to consult him or her about any changes in your eating patterns and any problems you have with appetite, eating, or digestion. Your doctor may refer you to a registered dietitian or physician specializing in nutrition for cancer patients. One of the most common side effects of cancer treatment is nausea.
First, don't try to pack in too much at once. Small, sort of mini meals can be a much easier and better tolerated solution. Also, cold or room temperature foods may be better tolerated than hot foods. And in fact, not even being in the room where foods are cooked so that you don't get the aromas from food can be a big help. Another tip is to separate the liquids and solids in your meal. Eat your solid meal first and then save the liquids till the end, and that seems to minimize nausea for some people. When you do have problems with nausea, first thing in the morning, nibbling on a few crackers or a little bit of dry toast can help to settle the stomach.
Warm ginger ale may also be helpful. It's also very important for patients undergoing cancer therapy to drink enough fluids.
It's very important for patients undergoing cancer treatment to drink enough fluid, especially those who are losing extra fluids with vomiting or diarrhea. Too little fluid can actually increase problems of fatigue. So unless your doctor's told you otherwise, drink 8 to 12 cups of fluid a day. And if you're having trouble with appetite, put those fluids in at the end of a meal or between meals.
Moving along further down the GI tract, you have either diarrhea or constipation as a possible side effect.
With diarrhea, you want to stick mostly with white foods, white rice, white bread, white crackers, things that are lower in fiber. With constipation, you want to flip the whole thing around. You want increased fluid intake, you want increased fiber intake, so brown rice, brown breads, more vegetables, things that have a higher fiber content.
Side effects that relate to loss of appetite and the taste of food can be helped with flavorings, sauces, and spices.
So maybe sweet foods will taste okay to you, the things that are sour will taste really bad, or vice versa. So if you're having problems with taste changes that are affecting your appetite, you can modify the kinds of foods that you're eating or the kinds of flavoring agents that you're putting into things to get the foods that will taste okay with the taste buds that you have that are working properly.
During chemotherapy and radiation, there might come a point where patients become neutropenic, which means their white blood cells decline to unsafe levels. If your white blood cell count drops to 1,000 or below, you are considered to be neutropenic. Until your count rises, it will be necessary for you to take additional measures to further decrease your risk for infection, such as eliminating uncooked food that may contain germs.
A neutropenic diet is for patients with a weakened immune system. If you are undergoing some cancer treatments, your immune system may be weakened and unable to protect you from bacteria that are found naturally in some foods and drinks.
Well, right now I'm on a neutropenic diet, which means low bacteria. So I average about 3 servings of veggies a day. Soup, I have probably fish at least 2 to 3 times a week. Either baked cod, some halibut, or some tuna fish.
We avoid certain foods like raw foods, salads, vegetables need to be properly cooked, dairy has to be pasteurized.
Doctors often recommend this diet before and after certain types of chemotherapy and other cancer treatments. A blood test called an absolute neutrophil count, or ANC, can help determine the body's ability to fight off infection. Many cancer patients have this blood test done routinely. A neutropenic diet. This diet should be followed until the doctor tells the patient to resume his or her regular diet. Some general tips include:
avoid fresh fruits and vegetables, even the garnishes on your plate. Go for cooked vegetables, go for canned fruit, go for juices.
Avoid rare or raw cooked meat, fish, and eggs. Meat should be cooked thoroughly and well done, and eggs should not be runny in the center.
Avoid the salad bar, the fruit bar on the deli counter. Go for vacuum-packed meats rather than freshly sliced meats.
You should avoid all raw nuts, but you may eat baked products with these in them. Make sure all dairy products you eat are pasteurized. Be safe in the way you handle your foods. Make sure you wash your hands before preparing foods. Also, make sure to wash all surfaces, cutting boards, and utensils after cutting foods. And you'll want to keep hot foods hot and cold foods cold. It's perfectly safe to use tap water at home. If you do choose to use bottled water, make sure it's labeled distilled or filtered.
Check with your doctor, nurse, or dietitian if you have questions about the neutropenic diet or safe food preparation. Whether to eat meat or not is always a major topic of discussion.
If you eat red meat at all, limit it to no more than 3 ounces a day. And limit the amount of fatty foods, especially those of animal origin, that you eat. Use appropriate vegetable oils in moderate amounts.
Excessive amounts of sugar and salt are to be avoided.
Well, in general, you should avoid things that are very high in saturated fat. You should avoid rancid food, because rancid food is, no one consciously eats rancid food, but you know, if you keep food hanging around long enough, you're going to run into difficulty with that.
One of the most important things that we can do to prevent cancer, in addition to not smoking, is to be avoiding overweight or obese. We have a considerable amount of data for breast cancer, a little bit less for colon cancer, that overweight and obesity after the diagnosis also adversely affect the prognosis and the long-term chances of survival for breast cancer in particular.
At least 2/3 of your plate should be filled with vegetables, and limit the animal proteins to no more than 1/3 of your plate. Many spices and herbs, including oregano, rosemary, turmeric, cumin, and garlic, contain antioxidants, powerful cancer-fighting ingredients. If your appetite is poor, or if you have taste changes, experiment with different spices and seasonings to see what's appealing to you now. When you are undergoing treatment, it's okay to be creative with your meals.
Now, I'll be making chicken with quinoa. First, I'm going to heat up my skillet to about a medium-high temperature with 1 tablespoon of olive oil. The ingredients that go into this dish are chicken thighs, sliced onions, diced tomatoes, minced garlic, reduced sodium, low-fat chicken broth, lime juice, fresh thyme, quinoa rinsed and dried, sliced green beans, fresh black pepper, and salt to taste. Now I'm going to add my chicken thighs to the skillet. You want your chicken to brown about 10 minutes on both sides. This is going to add a nice caramelized color and intense flavors to your dish. Now that the chicken has browned on both sides, I'm going to remove it and put it on a plate. I'm going to set this aside, and I'm going to add my onions to saute till they're lightly brown. This will take about 5 minutes to cook. The onions have sauteed now for a few minutes and they've gotten a nice brown color. Now I'm going to add my tomatoes and garlic. I'm going to let this saute for another few minutes until the tomatoes cook down. The onions and tomato add a lot of vitamins, minerals, and phytochemicals to your dish for good health. Now I'm going to add the chicken back to my pan. I'm going to add chicken broth to my dish, which is going to add richness. And I also add some lime juice to add a citrusy flavor. And I'm going to add some fresh thyme, which is going to give a nice savory flavor to my dish. I'm going to put the lid on now, and I want to keep the temperature at about a medium-high heat. Now my chicken's been simmering for 20 minutes. I'm going to add my quinoa and green beans now. Quinoa adds a great nutty flavor to my dish and is higher in protein than most grains. I'm also going to add green beans, which add a nice color as well as great texture to the dish. And I want this to cook for an additional 20 minutes with the lid on. Now my chicken and quinoa have been cooking for about 20 minutes. I'm going to turn the heat off and remove it to put it on the side. I want it to sit for about 10 minutes. I'm going to lightly fluff the quinoa. I have a delicious dish already prepared.
Alexis, that looks great.
Thanks.
You know, it looks like a really difficult recipe, but it's pretty easy to make. And you can also use beans, tofu, and seafood. You just need to adjust the cooking time accordingly.
Yes, and the oil is only 1.5 teaspoons per serving. It's a healthy kind of fat, so if someone really needs some extra calories, they could increase that just a little bit. On the other hand, for people where extra calories aren't their goal, they might even want to measure that oil, since more can get in the pan a lot quicker than you think sometimes. Quinoa is a great choice since it is a higher protein grain than most others, but you could also use other whole grains like brown rice or whole wheat couscous. And the neat thing about this is it's a one-pot meal. All in this one plate, you've got one serving of grains, a serving of vegetables that together are providing vitamins and whole grain nutrition, phytochemicals, and a serving of protein, perfect for somebody who's got a small appetite.
A simple and quick way to prepare a breakfast meal is crispy French toast.
First, we're going to start with the crispy French toast. And what you want to do to start off is turn on your pan. You want it to be nice and hot so you can put your French toast and it browns quickly. So you're going to start off by cracking your eggs. Now you want to add your nutritional supplement, about a half a cup. So now that you got all your liquid ingredients, you want to whisk. And you want it to be nice and smooth. You don't want any lumps from the eggs. If you're using a blender, you could just pulse it until it's nice and evenly mixed. There you go. It's nice and smooth. Next, what you want to do is get your cereal. And you want it nice and in small little bits and pieces. And you want to put it in a plate large enough so that you can have your bread fit. It could be a bowl or a plate, doesn't really matter. And then now you get your bread pieces. You can get whatever type of bread you like. This will work well with any kind of bread. So now what you want to do is immerse the bread in the liquid. You want it nice and soggy. And then you want to add it to the cereal and press hard so you get nice and crispy French toast. The more cereal, the crunchier it is. So if you don't like really crunchy foods, you cannot press down so hard and it won't be so crunchy. So you want to repeat that with the 3 pieces of bread that you have. So next what you want to do is get your cooking spray. You can use oil if you like. Cooking spray is just a lot easier. So you want to lightly coat your pan. It should be nice and hot. And then you get your French toast and place it down. So what you want is a nice golden color. I think we're just about there. Be careful not to burn because the cereal it tends to burn really quickly. What you can also do is get it nice and golden brown and leave it in the oven. This is great if you're having guests over or just making it for breakfast. You can just let it heat thoroughly in the oven. And there we go. Here is the finished product.
What a great way to get some concentrated calories and protein. This is especially great if you're having problems with off tastes from meat. Get the calories and the protein. And when you use a liquid supplement like this, it's lactose free. So if you've had any problems with digesting lactose, now you don't have to worry about that.
Cancer research is an ongoing activity, and scientists are working hard to find the answers. There is evidence that a diet high in vegetables, fruits, and whole grains, along with less fats, alcohol, and salts, can help speed your recovery from cancer.
Priority 1, I'm alive. Nothing else really counts. Nothing isn't important anymore. Just to be alive. And also very important was believe it or not, you have to have hope. You have to have people supporting you, and you have to have a goal. My goal was my grandchildren.
We know that your immune system responds to how you feel. If you turn off the right kinds of T cells, they get weak, and as they weaken, they're unable to protect you. And we know that the best way of turning your good cells on, your T helper cells that can help defend you, is a good mental outlook. This means staying optimistic, realizing that although stuff happens, you may have been dealt a bad set of cards, you have the ability to play those cards well. And especially as medical technology catches up with you and we get more insights into what the alternative world of healing can provide, it turns out you're in a pretty good place right now. So keep your head up.
If you'd like more information about your treatment options and how to live well with cancer, contact the American Institute for Cancer Research. The website of the American Institute for Cancer Research offers news and features on diet and exercise recommendations for cancer patients. And look for resources in your community. For example, New York-Presbyterian Hospital offers nutrition consultation services and provides nutrition information on their website, www.nyp.org/nutrition.
But then there's so many other positive aspects of my life that I led. It's like, would you give some dietary changes up to keep your friends, to keep your family, to keep, your aspirations to finish law school and business school up? And answer is, of course, yes.
I think that what we all learned from our mothers about eating fruits and vegetables still holds, and that is there are wonderful nutrients, and there's a lot to be said for having a balanced diet. If people cannot have a balanced diet, then there are certain supplements that can be added to the diet to make sure that people are using every opportunity possible to get through their cancer treatment in the strongest fashion possible.
I think a lot of it also, it's medical, and also it's, your mind. You have to really remain positive and upbeat. I'm not upbeat, but just know you're going to fight it and do everything you can.
Some days, you have your bad days, you have to deal with them. There's nothing you can do about it. Some days I'm in bed and I can't move, Nothing you can do about that. My advice is just to be positive, keep eating, eat well. I think those are the most important things.
I believe you have this magnet theory, and I'm a firm believer in prayer and in positive thinking. And I've had so many of the patients live well beyond what they were told originally, and a lot of it has to do with just positive thinking and positive outlook.